Gaining freedom from health debt is really what this podcast and greatmed.org is all about, putting power in your hands to improve your God-given ability to be healthy. Many people with preventable disease want to make lifestyle changes. They want to improve or reverse disease, but they don't know how. Walk, Don't Run to the Doctor is the resource hub that is a cure for a common confusion about healthy living. Welcome back to Walk, Don't Run to the Doctor. I'm Miles Hassell, MD. I'm a physician at St. Vincent Hospital in Portland, Oregon. And today I'm going to open a couple of letters that people have sent to us. The first one is from Marie. And so she says, I'm enjoying the podcasts. I'm wondering if the topic of gallbladders will be covered sometime. Low-functioning gallbladder and gallbladder removal, alternatives to surgery. And it's a personal concern since my youngest daughter has gallbladder disease. She's also been diagnosed with some other things. I'm wondering if it's the immunizations. I guess I might be a conspiracy theorist. And I'm trying to help my daughter any way I can. So, I don't know about the immunizations and gallbladder disease part of this, but the majority of cases of gallbladder disease are preventable. Not every case, but the majority. And so let's talk about how her daughter might be able to take some steps. So, the risk factors for gallbladder disease are any medical student can tell you are primarily being overweight, female, fair. 40 is often a factor as well. So your early middle-aged female, fair, and overweight lady is at most risk, but anybody might get gallbladder disease. So young people can get gallbladder disease, old guys can get gallbladder disease. Don't get too concerned about those particular factors. So let's pretend you've got gallstones. You're having gallstone attacks, and you're being told you need to have gallstone removal surgery, gallbladder removal surgery. Maybe you do, but you might want to try some other things first. And so, first of all, slow weight loss. Rapid weight loss actually accelerates gallstone disease and causes more problems. So, slow weight loss, a pound every week or two, in the context of a high-fiber diet. So fiber is really critical for gallstone formation, probably because of the ability of fiber to remove some of the bile stone, the gallstone forming agents from your body. And so slow weight loss using a high-fiber diet, and the one we use primarily is a Mediterranean-style diets that are concentrated on fruits, vegetables, beans, grains, plus animal proteins, plus normal levels of fat. Then let's think about fat for a second. So fat, such as olive oil, rarely triggers most of our patients' gallstones, but some do. So the thing is to sort of know what are your triggers and avoid them, but we don't put people on a low-fat diet. And most of our patients tolerate olive oil. Oddly enough, we find that egg yolks are surprisingly well tolerated as well. And that's kind of interesting because egg yolks have a lot of lecithins. So they have a lot of cholesterol, which can contribute to gallstone formation. They also have a lot of lecithin that contributes to less gallstone formation. In our experience, it appears that egg yolks are actually helpful for patients with gallstone disease. The next thing is get rid of the sugars and any kind of flour product that you buy from outside the home. So most flour products, that's things like breads and pastries and crackers and pasta, really are made of foods that are extremely high in simple carbohydrates that are very rapidly metabolized. And for some reason, then sugars and refined carbohydrates seem to be big contributors to gallstone disease. So get rid of those foods out of your diet. Find pleasurable things that you can have instead. And really take this part seriously because in our experience, it's probably the single most important factor. Next, increase the water-soluble fibers. So we will often actually just have patients eat a bowl of oat bran every day, which is a really easy-to-use way of getting water-soluble fiber in your diet. And if you cook up some oat bran with, for example, a ripe banana, you can really make a nice cereal out of it. Is that the only game in town for water-soluble fibers? No, but it's probably the easiest. So do all this and then add an exercise component. Exercise changes every aspect of your metabolism in favorable ways. So make sure you're getting exercise every day and preferably more than once a day. So for example, we typically will prescribe 1 minute of exercise 3 times a day. And what that does is change your metabolism throughout the day, speeds up your metabolism, changes your hormone levels, and these kinds of factors used together seem to allow patients to avoid gallbladder surgery quite often. Not in every case, so you want to keep your surgeon on speed dial. So if I can give you two recent experiences among our patients. One patient really couldn't get off the sugars. She struggled with weight issues. She couldn't get off the sugars. She had her gallbladder taken out. The other patient, also female, about the same age, said, I need to get rid of these sugars, huh? And she found enjoyable things that would replace the sugars in her diet. And so I'll just use an example for myself. I love sugar like most people do. But if you give me a ripe banana, a handful of raw nuts, and a little piece of dark chocolate, by dark chocolate I mean something with 80 or 85% cocoa, that combination is delicious for me. And it will allow me to overlook almost any other treat in my environment. But I have to plan ahead. Otherwise, if I'm hungry and somebody brings something that's utterly delicious and really bad for me, it's going to be really hard to refuse. But if I have food at hand that replaces those treats that I shouldn't have, then that makes life a lot easier for me. So our patient that was able to maintain the exercise, keep her weight down, she added a bowl of oat bran every day and some egg yolks, along with a healthy diet overall. And did I mention she got rid of the sugars and refined flours out of her diet? She was able to avoid getting the surgery. So two almost identical cases in many ways with radically different results. Something else is often overlooked when you're following a good diet, you're minimizing your sugars, you're including some good fats, such as olive oil and egg yolks. Now think about what is going to transform all of those things into something good for your body, and that is probiotic foods. So when you eat probiotic foods like yogurt and kefir and fresh sauerkraut, you're providing all these bugs that work on those fats and those fibers in your body to form all kinds of compounds that make you healthier all throughout your body, including your gallbladder. Stay tuned for an episode where we will just concentrate on gallbladder disease and what can be done about it, both prevention and treatment, in the hopes that it would appear that most people can avoid gallbladder replacement surgery, but not everybody. So our patient that had the surgery, her biggest trap was caramel lattes. And so she just couldn't seem to not have her caramel lattes. Well, I would argue that somebody who really loves caramel lattes, if they have a nice cup of coffee with some whole milk, maybe a dab of vanilla, maybe a dab of honey, is going to be able to replace their caramel lattes, keep their gallbladder, and do much better. And remember, coffee is not bad for you. Coffee is actually protective against gallstone disease. So at no point should my criticism of caramel lattes, which are kind of a candy bar in a cup, at no point should that interfere with the fact that coffee itself is a really good food. Coffee and tea, they're great foods, and coffee in particular is protective against gallbladder disease. The second letter is from another lady who would prefer to remain anonymous, and she writes, Dear Dr. Hassell, I wanted to give you an update on my left knee. Both the PA and the surgeon told me there was nothing left for me to do except to have knee replacement surgery. My knee had been getting progressively more painful and swollen, and I was unable to do my regular exercises. And she also, her job includes cleaning houses, and so it was getting in the way of her being able to do her work as well. The letter continues. However, you suggest I postpone the surgery for 3 months and try some nutritional techniques. When I called the orthopedist's office, they laughed at me and questioned my decision to wait. I decided to make the changes you suggested and continue to get physical therapy. When I visited the physical therapist the same week I saw you, she told me that you might be right, and that if she worked with her for 3 months, she might not need the knee replacement surgery. While I haven't been able to acquire a rowing machine or exercise bike, which is the standard things we recommend, I've consistently done all the exercise recommended by the PT. And just by the by, it's worth remembering nobody needs fancy machines to get fit to do exercise. Fancy machines might make it easier, that might make it more fun for you, but never feel that you're limited in your ability to get fit because you don't have a fancy machine. So back to the letter. I've been astounded by my progress. I'm cautiously optimistic because the swelling has gone down and I'm pain-free. I'm able to be pain-free for all my normal activities. Yesterday I cleaned a client's home, 3 bathrooms, multiple stairs, and I had no pain at all despite hours of bending and stairs and cleaning. I can be on my feet all day with no pain. I'm taking no pain medications. I can cook a meal and taking me an hour or so with no pain. To me, it is a miracle. So what did she do? So when we think about osteoarthritis, which is a fairly complex disorder, but fundamental to it is the breakdown of the cartilage in the joint. It's not only that. It's much more than that. And our episode 23 goes into detail about approaches to osteoarthritis, which is what this lady had. And it's the most common contributor to needing knee and hip replacement surgery. But what she did was watch her weight. She was already pretty fit. Be fit, because motion is lotion for your joints. Just because a joint hurt doesn't mean you stop moving. You find ways of moving that your body can tolerate. Thirdly, you get rid of the sugars and go on a really good diet. So it's really odd how sugar metabolism affects the breakdown of joints, and we don't really fully understand it. But for example, type 2 diabetic patients who obviously have a sugar metabolism problem are at about double the risk of needing joint replacement, like knees or hips, than somebody the same body size, the same age, who does not have type 2 diabetes. So don't underrate the importance of getting rid of the sugars and foods made with flour from outside the home. So that's breads, pastries, pastas, crackers that you didn't make yourself. And there's a variety of metabolic reasons why that difference is important. So sugars and rapidly metabolized carbohydrates, like most baked goods from outside the home, should be abolished. Go on a really good diet. We don't know why things like fruits and vegetables and beans and grains contribute to better joint health, but they do. And so we use a Mediterranean-style model, which is fruits and vegetables, beans and grains, good fats, which includes dairy fats and especially olive oil, and dairy, eggs, meat, fish, so basically all the foods that people have historically eaten, but prepared at home and eaten in their unprocessed form. It's worth thinking about the probiotic foods in your diet, because if you can change your metabolism in your intestinal tract, you change your metabolism throughout your body. So in addition to a great diet, making sure you have some probiotic foods every day. So that's for us, that's things like yogurt and kefir, fresh sauerkraut, homemade sourdough, things like that. And so when you combine all those factors, and then think that alone can often help, especially if you're overweight. If you're overweight and you've got bad joints, reducing your weight really takes a lot of the mechanical load off that joint, and in and of itself can be very, very helpful. Finally, this is one of those few areas where we use nutritional supplements. The first one we use is actually gelatin, just like 1 tablespoon or 1 sachet of plain old gelatin. Most people use it in a hot drink and just take that down every day. A second thing is glucosamine sulfate. A third is MSM, and a fourth is niacinamide. And the amounts for all of these are discussed in our episode 23 podcast. And then we try it for 3 months. It'll either help you or it won't. If you see a significant benefit, like this lady did, we often see people who just simply don't need their joints replaced, even though they were told that they did. Somehow the body has been able to repair that joint. It doesn't work for everybody. So if you try all these things and it doesn't work, don't see yourself as a failure. See yourself as an outlier. And take advantage of what modern medicine has to offer. But remember, most people don't need modern medicine. So whenever you're listening to our podcast, think, can you rewrite your future? Can you avoid major diseases? Can you avoid major surgery, even after you have a diagnosis? Or can you make your outcomes from surgery or treatment for a disease much better because you're taking control of the lifestyle components that you can control? Weight loss, diet quality, fitness levels. Even if you need surgery, for example, if you've addressed weight loss, diet quality, fitness level, you're going to do much better with that surgery. You're going to come out of it better. You're going to recover faster. You're going to be less likely to have surgical complications such as infections. And that's really important. Let's pretend you still have cancer. Lots of cancer in my family. We haven't been able to avoid every aspect of ill health. But if you're fit and you're eating well and you have your weight under control, your waistline, then even the cancer patient who's getting treatment for cancer, surgery, chemotherapy, radiation, immunotherapy, does much better. We have multiple studies showing that they do much better with their conventional therapy than if they weren't those people. So remember, your lifestyle choices are critical, both for avoiding medical interventions, or if you have a medical intervention, avoiding complications of that medical intervention. In other words, you'll do better either way. So when you think about the cases that we just discussed, remember, we're talking about people who actually were able to avoid major surgery. That means avoiding major surgery complications. It means having more life. So instead of recovering from surgery, they're playing with their grandchildren. Instead of being a burden to their kids and their grandkids, they're contributing to their kids' and grandkids' lives. So all these things come together to make for a better life. If you're in the Portland area, you might want to consider joining us for our next live event. We're going to be doing a lifestyle medicine town hall concentrating on the topic of osteoporosis and preventing fractures. And that'll be on October 9th of this year, 2025, at the Souther Auditorium at St. Vincent Hospital in Portland, Oregon. Maybe you're wondering where to start with putting all this together in your home, in your kitchen, in your lifestyle. You might want to consider getting good food, great medicine. Now, I do have a bias on this because this is a book that I wrote with my sister Mia. It's in its 4th edition, and it covers sort of how to employ a healthy Mediterranean diet, why to employ a healthy Mediterranean diet, how to make it easy, how to use, we have a couple hundred simple recipes that are really quick to prepare. We have ideas on how to avoid making mistakes when you're eating out, if you do eat out. We have ideas for shopping and for organizing your pantry to make all of this easier and more effective. We also have the full range of data as to why this is important. How does diet and exercise help your mental state, your cancer risk, heart disease and stroke, type 2 diabetes? Maybe you can actually reverse type 2 diabetes. How you can improve aging. How you can reduce frailty as we get older. All of these things are bundled up in this book, and we think that you may find it really, really helpful. Thank you for listening to Walk, Don't Run to the Doctor, and we'll see you soon.